What if the blood pressure number that scared your doctor enough to add another pill was actually completely normal for someone your age? And what if the number your doctor told you was fine is the one quietly putting you at risk? I know that sounds backwards, but after 22 years of treating blood pressure in adults over 60, I can tell you the most dangerous thing about blood pressure is not the number itself. It's that almost nobody, including some doctors, is reading it correctly. Here's a number that should genuinely concern you. More than 7 out of 10 adults over 60 have blood pressure that's classified as elevated or high. 7 out of 10. That means if you're sitting here right now and your numbers are a little high, you are not the exception. You are the overwhelming majority of people your age. But here's what almost nobody explains. The risk of heart attack and stroke doesn't switch on at some magic cutoff line. It rises slowly, quietly, starting well below the always number most people think of as dangerous. So the real question isn't just, is my blood pressure too high? The real question is, too high for whom? Too high under what circumstances? And too high compared to what? By the end of this video, you're going to understand your own blood pressure numbers better than most people ever get explained to them in a doctor's office. And I'm going to give you the real danger zone, a number that takes 5 seconds to calculate from your own reading that almost no one checks, and that may predict your risk more accurately than either number on your monitor alone. I'm a cardiologist, and for over 32 years experience, I focus specifically on blood pressure in adults over 60. I've sat across from thousands of patients who were confused, frightened, and getting completely different answers from different doctors. And before we go any further, here's the question I want you to sit with for the rest of this video. It's not, is my blood pressure too high? It's, do I know my real number? Most people don't. By the end of today, you will. The rule that cost an entire generation. Let's start with where most of the confusion began. For decades, doctors were taught a simple formula. Your normal systolic blood pressure should be 100 plus your age. So if you were 70 years old, a reading of 170 was considered completely fine, normal, nothing to worry about. That rule is no longer used. And we now know it left an entire generation of people walking around with blood pressure that was silently damaging their hearts, their kidneys, and their brains while everyone involved believed everything was fine. But here's the part that almost nobody talks about. When the guidelines corrected the course, they corrected hard. In recent years, the definition of high blood pressure was lowered, and overnight, millions of people who felt completely fine, many of them over 60, were suddenly reclassified as having a medical condition they didn't have the day before. So now you've got two extremes, an old rule that undertreated an entire generation and a newer standard that for some older adults may be too aggressive. Somewhere in the middle is the truth, and that's exactly what I want to walk you through, what the two numbers actually mean. Before we get to the ranges, you need to understand what you're actually looking at, because this is where most people get lost from the very beginning. Your blood pressure has two numbers. The top number is your systolic pressure. That's the force of blood pushing against your artery walls. The moment your heart beats, the moment it squeezes. Picture a wave crashing against a seawall. That's your systolic pressure. Every heartbeat that wave hits. The bottom number is your diastolic pressure, the pressure in your arteries between heartbeats when your heart is resting. Think of it as the water level when the tide pulls back. It's the constant background pressure your blood vessels are under every second all day long. Here's why this matters so much after 60. As we age, our arteries naturally stiffen. They lose some of their flexibility. And when an artery is stiff, that wave from each heartbeat hits harder because the artery can't expand to absorb the impact the way a younger, more flexible artery would. That's why the top number, systolic, tends to climb as we get older. It's not always disease. Sometimes it's simply the natural aging of the blood vessels. But the bottom number often does the opposite. As arteries stiffen, they don't recoil as well between beats. So diastolic pressure often stays flat or even drops after 60. This creates a pattern that's extremely common in adults over 60 and one that almost nobody has ever explained to them. The top number is elevated while the bottom number is normal or even low. This pattern has a name: isolated systolic hypertension, and it is the single most common form of high blood pressure in older adults. The real numbers. What's too high after 60? So let's get to the part you came here for. What numbers should actually concern you? For adults between 60 and 75, a systolic pressure below 130 at rest is ideal. 130 to 139 is acceptable, especially if you feel well. 140 to 149 needs monitoring and some lifestyle attention. And 150 or higher consistently at rest. That's the number that needs real action. For adults over 75, the goal shifts slightly. Below 140 is generally the target. 140 to 149 depends heavily on how you feel and your individual fall risk. And 150 or above consistently is too high regardless of age. On the diastolic side, below 80 is ideal. 80 to 89 is something to watch over time. And 90 or above consistently puts ongoing strain on your arteries and organs that adds up over the years. Now here's the part where I want you to actually grab a pen or pull up your last few readings on your phone, because what I'm about to show you can calculate yourself in 5 seconds. And it might be more important than either number you've been focused on your entire life. The real danger zone, the hidden third number your doctor has never calculated. Remember the question I asked you to sit with at the start of this video. Do you know your real number? This is it. This is the real danger zone I promised you. There is a third number hiding inside every blood pressure reading you've ever taken. Nobody ever points it out. Most doctors have never once mentioned it to their patients. And research suggests that especially after 60, it may predict your risk of heart attack and stroke more accurately than your systolic or diastolic number on its own. It's called your pulse pressure. And here's the good news. You already have everything you need to calculate it right now. Pulse pressure is simply the gap between your top number and your bottom number. That's it. Subtract the bottom from the top. So if your reading is 150 over 70, your pulse pressure is 80. If your reading is 130 over 80, your pulse pressure is 50. Why does this matter so much? Because that gap is a direct measurement of how stiff your arteries have become. As arteries stiffen, the top number gets pushed up and the bottom number tends to drift down. The gap between them widens, and that widening gap is one of the clearest warning signs of arterial aging that exists. Here's how to read your own number. A pulse pressure below 40 is normal. Between 40 and 60 is acceptable, but worth keeping an eye on. Above 60, that's it. That's the real danger zone. That's the number that tells you your arteries may have lost significant flexibility and that your heart is working harder than it should have to, no matter how good your other two numbers look. Think about a reading of 160 over 70. Most people would look at that and focus entirely on the 160, but the pulse pressure is 90. That's not a small detail tucked inside. A bigger number. That 90 is the story. That's the real danger zone. Music hiding in plain sight inside a reading you've probably looked at 100 times without ever doing this one piece of math. I want you to pause this video right now if you need to. Take your last reading, even one from a few days ago, and do the subtraction. Top number minus bottom number. That's your pulse pressure. Now down in the comments, I want you to tell me two things. Your most recent blood pressure reading and the pulse pressure you just calculated from it. I read every single comment on this channel, and if your numbers raise any flags, I'll do my best to respond directly. When the bottom number drops too low, now here's something that almost nobody warns patients about. Something that can be just as dangerous as a number that's too high, a diastolic number that's too low. I want to tell you about a patient I'll call Robert, 71 years old, retired school teacher on 2 different blood pressure medications. His systolic was well controlled, sitting around 126. On paper, that looked like a success story. His chart even had a little note in it. BP well controlled, no changes needed. But Robert kept telling me he felt foggy in the mornings and that he'd had 2 close calls where he nearly fainted getting out of bed to make his coffee. He'd started holding on to the bathroom door frame every morning just in case. When we checked his full reading, his diastolic had dropped to 54. His doctor had been so focused on getting the top number down, chasing that well-controlled note in the chart that nobody had noticed, the bottom number had quietly fallen into dangerous territory. Robert's chart said his blood pressure was fine. Robert's real number said something different. When diastolic drops below 60, the pressure between heartbeats may not be enough to adequately supply the heart muscle itself, and that can show up as dizziness, fogginess, and a real risk of falling. We adjusted one of his medications carefully under close supervision. Within a few weeks, his diastolic came back up to around 68. The focus disappeared, the near fall stopped, and his systolic stayed right where it needed to be. The lesson here is simple, but it's one almost nobody hears. Don't just watch the top number and don't just watch the bottom number. Calculate the gap and make sure that the bottom number hasn't quietly dropped below 60 in the process of controlling the top, the spike that felt like an emergency. Now, let's talk about the other side of this, because I promise you at some point you or someone you love is going to look down at the home monitor and see a number that feels terrifying. I want to tell you about a patient I'll call Margaret, 68 years old, retired, generally healthy. One afternoon, she called my office in a near panic. Her home monitor had just read 182/98. She told my receptionist she was already standing by the front door with her purse and her shoes on, ready to drive herself to the emergency room. I asked her 3 questions. Do you have a headache? No. Any chest pain or pressure? No. Any changes in your vision or trouble speaking? No. I asked her to put the purse down, sit back in her chair, put her feet up, close her eyes, and breathe slowly for 10 minutes, then retake the reading. She called back 12 minutes later, a little embarrassed, laughing about the purse, and the new reading was 148/84, still a little elevated, but nowhere near crisis range. What had happened right before that first reading, Margaret had been on the phone with her sister, and the conversation had gotten heated. Her body had flooded with stress hormones. That number 182/98 was real, but it wasn't her real number. It was a reaction, not a baseline. This is one of the most important things I can teach you in this entire video. We do not treat single spikes, we treat patterns. 1 high reading is a data point, 2 weeks of consistently high readings is a pattern. Learning to tell the difference can save you from a completely unnecessary trip to the emergency room, or worse, from years of medication you may not actually need. When it is an emergency, the numbers and symptoms that mean call 911. But I need to be very clear about the other side of this, because the difference between sit down and breathe and call 911 can save your life. If your reading is above 180 systolic or above 120 diastolic, and you're experiencing any of the following, this is not a moment to wait and recheck. This is the moment to call for help immediately. A sudden severe headache unlike any you felt before. Chest pain or a sensation of tightness in your chest, new or worsening shortness of breath, sudden changes in your vision, blurring or partial loss, difficulty speaking or sudden confusion, numbness or weakness on one side of your body. These symptoms combined with a severely elevated reading can mean your organs, your brain, your heart, your kidneys are being damaged in real time. This is not the moment for the breathing protocol I just described for Margaret. This is the moment to call 911. The difference between Margaret's situation and a true emergency wasn't the number on the screen, it was the presence of those symptoms. A high number with no symptoms is a signal to monitor. A high number with those symptoms is a signal to act immediately without delay. How to measure correctly so you actually know your real numbers. Everything I've told you so far only matters if the number you're working from is accurate. And here's the uncomfortable truth. Most home and even office readings are wrong, often by a wide margin. Sitting down without resting first can add 10 to 15 points to your systolic reading. Talking during the measurement can do the same. Crossing your legs can add another 5 to 8 points. Stack those together and you could be looking at a number that's 25 to 30 points higher than your true resting pressure, which is the difference between a completely normal reading and one that triggers a new prescription. Here's the protocol I give every one of my patients over 60. Sit quietly for 5 full minutes before measuring. Feet flat on the floor, back supported, arm resting at heart level. No talking, no phone, no television. Take 2 readings 1 minute apart and record the lower of the 2. Do this twice a day, once within the first 20 minutes of waking before coffee and once before bed for 7 consecutive days. That gives you 14 readings. Average all of them together. That average is your true baseline, not a single rushed office reading, not a number taken after walking in from the parking lot, your actual resting blood pressure. If that 7-day average is consistently above 150 systolic or 90 diastolic, that's a number worth bringing to your doctor with confidence, not panic, but confidence, because now you actually know what your real number is. Quick check-in. If you've made it this far, you're already ahead of almost everyone who's ever had their blood pressure taken. Drop it in the comments so I know how many of you are still with me and that it's worth making more of these. Let's bring this together, because I want you to leave this video with clarity, not confusion, confusion and with a sense of control, not fear. Remember the question I asked you at the start. Do you know your real number? Let's make sure you do. You now know your blood pressure has two numbers that measure two completely different things. The top number, your systolic, tends to rise with age as arteries stiffen. The bottom number, diastolic, often holds steady or even drops. And if it falls below 60, that's a warning sign almost nobody checks for. You know, the real range is for adults over 60. Below 130, systolic is ideal. 150 or higher consistently needs real attention. Diastolic below 80 is ideal, and 90 or above consistently is too high, and you now know the real danger zone. The one most people your age, and frankly most people any age, have never been taught: your pulse pressure, the gap between your top and bottom numbers. Below 40 is normal. Above 60, that's it. That's the zone. A signal that your arteries may have lost significant flexibility. You can calculate it in 5 seconds, and now you have. You know the difference between a spike and an emergency. A high number without symptoms. Sit down, breathe, recheck in 10 minutes. A number above 180 over 120 with severe headache, chest pain, vision changes, or one-sided weakness. That's not a number to sit with. That's a call to 911. And you know how to measure correctly so that the numbers you're working with are actually true. In 22 years of practice, the biggest problem I see isn't blood pressure that's too high. It's patients who don't understand their own numbers. Patients who are afraid of a reading they can't interpret or reassured by a day and day shall reading that was never accurate to begin with. Understanding your numbers doesn't create fear, it creates power. The power to ask the right questions, to measure correctly, and to really know the difference between a moment to breathe and a moment to act. So here's what I want you to do right now. Take your blood pressure tonight using the protocol I just walked you through. Calculate your pulse pressure, and in the comments tell me both numbers, your reading and your pulse pressure. That's your real number. I read every single comment, and if something in your numbers concerns you, I want to know. If this video gives you real clarity, please subscribe. It helps me reach more people who need this exact information. And if you know someone over 60 who's been confused by mixed messages about their blood pressure, send this to them. It might be the one thing that helps them finally know their real number too. I'm Dr. Mike. Know your real number. Take care of your heart, because everything else depends on it.